In Your Health Matters, the latest in diabetic wound care. People with diabetes are more prone to foot issues, especially foot wounds and foot ulcers. But now there's some encouraging news regarding the way that doctors care for diabetic wounds. The magic seems to be in biologic membranes, and they're being used right here in the Valley.
The problem is because of the very poor blood supply and the high blood sugar, then the white blood cells, which are responsible to take care of any infection in the foot, they have a very sluggish movement in the bloodstream.
Until very recently, the standard of care has been to keep the infected area cleaned and dressed regularly, with healing normally taking months. Now, using this biologic amniotic membrane, the same fluid surrounding a fetus, wounds are healing much faster.
These have been known to have the most cells that can regenerate really quickly, which help us in multiple areas of medicine, especially in diabetic feet.
As you can see here, the membrane is placed directly on the wound. Using this method, healing can happen in as little as 2 weeks.
The cure rate is much better, and the healing rate is much faster.
Infectious disease specialist and internist Dr. Younnes is one of 2 principal investigators here in the Coachella Valley involved in the study of the biologic membrane, which has been approved by the FDA but isn't covered by insurance. This study is being done to prove to insurance companies that the membrane is working and should be covered. However, the doctor also makes the point that patients need to control their blood sugar. If so, he says, there's a very good chance the wound won't come back.
Controlling the blood sugar is of the utmost importance, and if the blood sugar is not controlled, no matter what we do medically, the wound will probably never heal.
Now, clinical trials are currently underway right here in the Valley, and they need patients. There is no cost, and transportation can be reimbursed. If you would like to take part, call this number, PalmTree Clinical Research, at 760-778-7799. Again, 760-778-7799. Diabetes is called the silent killer, in large part because of diabetic neuropathy. That's why it's so important for patients to control their blood sugar, keep a very close eye on their feet, and report any wound to their doctor so it can be taken care of quickly, because your health matters.